It's Dr. Karthik Ram. Welcome to my podcast. I'm a board certified plastic surgeon and educationalist based out of Chennai. I'm really honored that you have taken your time and given me your gift of your attention. Hope you are going to love this session. Please follow me in my Instagram handle for more updates. My Insta handle is Ram Dr. Karthik, RAMDRKARTHIK. Enjoy today's podcast. Hi friends, Dr. Karthik Ram here, and after a little more bigger gap, coming up with the Plastic Surgeon Diary, the next episode. I think it's the 10th episode, and we want other people to join. Especially, I want Dr. Joyce to join so that just we'll speak about something. We'll speak about some interesting cases in the last few weeks, and in this plastic surgeon diary will be a big remembrance for doctors. For us itself, it's a big remembrance because when we go through the plastic surgeon diary, we just recap our practice in the future. That's also one of the aim, and that's also one other interesting thing is like we also give a lot of interesting. We talk about a lot of interesting patients as well as a lot of information we provide here. So hopefully this plastic surgeon diary will be useful to you. And I think Joyce has joined. We do a lot of hard work to make each and every patient of ours happy. Okay, but still, okay. So but still some patients we can't make them happy, so they'll get disappointed. It happened in the last few days back, and uh, they that actually couple came with two small kids. They haven't fixed any appointments, and they came for sudden after the consulting hours. They came and almost we closed down the OP, but they asked for a consultation for the earlobe repair. Basically, that when the earlobe become bigger, they want to stitch it and make it. Basically we close the earlobe, and then again after 1.5 2 months they pierce the ear back. So she came for the wife came for a earlobe repair. So Dr. Joyce and Dr. Anita saw them, and they explained how the procedure done and how will be what will be the cost and other details. She went outside after the consultation. They left and they went to the reception area. That time they asked for the consulting fees. They said 1,500 is the consultation fees. Basically, what we do is we want to see the seriousness of the consultation. We kept our consultation fees a little higher, but this consultation fees, whatever we collect, stays there for 1 year. After 1 year, within a year, how many times they came for even the review, post-op, whatever, we don't charge them anything. That's the reason we keep the consultation fees in 1,500. So the husband asked, did you charge everybody the 1,500? My staff told us we charge 1,500. So they paid and they left. As soon as they left, I saw some negative reviews in our Chennai Plastic Surgery the page. Then I realized this patient, he wrote simply like this: this is a cheating clinic. Okay, don't go to this clinic. Without even touching us. I don't think for earlobe repair anybody can touch and see anything there because that's just a visible one. No need to touch anything. Without even touching the patient, they charge 1,500 for 1 minute consultation. Think about if they touch you, how much will they charge? Kind of. I mean, that's what happened. So like it sometimes like make you feel low because like you put your effort, all your effort, and you are trying to help patient. Though it's a cosmetic practice, everybody are coming up with a lot of unhappiness, a lot of disappointments, a lot of emotional traumas. We are trying to fix each and every one of the patient coming here. But when the patient, without even understanding our routine practice, they go back and write some negative reviews, and we understood they haven't felt the value for the money because they pay 1,500 rupees within 1 minute. The consultation is over. That we understood the fact, but this is not the way they need to react to us. See, we paid the money back by GPay immediately. As soon as we paid the money back, wife also put a negative review. Okay, like in our center, if you see, We have more than 900 and odd positive reviews and few negative reviews. But when they add these negative reviews for the unnecessary reason, it really irritates us. But yes, people are, we can't expect the same thing from each person. They are like that. We show gratitude by paying the money back, and we don't want to strain them with uh, uh, the, the charging them more. If you see our practice, most of the time we do consultation free of cost in a lot of poor patients. We don't even ask for the money. Even they paid the money. A lot of times I'll ask them to refund the money because they're poor. They don't charge them, don't charge much for those patients, or refund the patient. Like that only I told them and give the money back. Yeah, we are surgeons. We are not dependent on our consultation fees charges, but just to make this, just to give this, what do you say, to make them understand the seriousness of the consultation, we charge more. So in the last couple of, maybe we can say last 2 months, once the COVID is kind of coming down, we become really busy. We do almost 4-5 surgeries in a day, and our team also fully supporting me, my doctors, my staffs, and everybody. And we are making a lot of people happy, and a lot of learning for the doctors as well as me, as well as we are providing some more better results for a lot of patients in our center. So now, coming to the next thing, last couple of weeks we are doing a lot of breast implants, a lot of tummy tucks, and a lot of interesting cases. Gynecomastia, every day we do 2-3 surgeries in our center. So hi to Harish, hi to Sanjeev, and a lot of Hamlin also there. Hi to Hamlin. So everybody, hope happy to see all you here. And one other interesting patient, she connected with us in WhatsApp, and she asked for the Brazilian butt lift surgical consultation. And we said your consultation time is 10 to 12:30 in the morning. And she said, no, I can't come in the morning. And the reason is the Chennai is very hot. I can't come out of the house in the morning time because it's too hot. Only I can see him in the evening. So we also say, okay, we see evening OPs, we'll have only one day on Wednesday only. So we told, okay, come on Wednesday at around 4:35 in the evening. And she's asking some more interesting questions like, like doctor is experienced with us specifically for this procedure, or have the doctor visited specifically to this center, this Brazilian butt lift centers, and learned something? And before even she comes, she is demanding so much. Sometimes, like, you select your patients. Okay, sometimes we feel that no, this patient is not mine, because doctor and patient has to get along with each other, and the mindset has to be in a similar way, so that when they do the consultation, we know, okay, this is my patient. The patient also know this is my doctor. Sometimes it won't suit match. That time we need to decline them the procedures, and so that they'll select the other doctors which they are comfortable with. This is a cosmetic surgery, something different. It's not the.
Thank you, sir.
So I spoke about.
Yeah, I was
I spoke about. Okay. Yes, Joyce. What is the next patient we are going to talk about?
So the next patient, actually, I want to come up with something positive. So it's a new venture of yours recently, and that is to do rhinoplasty under local. So can you just share with us about that patient who was a doctor himself, and who was so concerned and worried about his nose from years together, and he was very insistent because of his health conditions that he wanted to do the rhinoplasty under local anesthesia. So you were also convinced and you went ahead. So please share with us that experience of yours.
See, I usually don't prefer local anesthesia for the rhinoplasty, because what normally happens is when we hit the bone and break the bone for the narrowing the bone and all, very uncomfortable. But luckily, this patient, this doctor, has only the work in the tip area, narrowing the tip, narrowing the base, and narrowing the alar base, and narrowing the nostril base. Only the work is mostly in the tip area. So what we did is we initially I also discouraged him, don't go for, because it's not comfortable to the doctor as well as the patient. But he said, somehow I'm not comfortable with general anesthesia. My family is also not accepting for the general anesthesia. Please do it at a local. So I also agreed, and my anesthetist was standby, but he has not given any sedation or something. But we gave only the local anesthesia. We did the infrared nerve blocks and blocks here, as well as a little bit of the local infiltration. And he has tolerated the procedure very well, and we finished it in 1 hour time. And immediately, usually it's not a like luxury to show the patient immediately after surgery. So in this case, we'll make him sit immediately after surgery, and we'll show it in the mirror. And see, because usually the problem in the nose surgery is after some time the swelling sets in. Once the swelling sets in, they can't see the full results. So, but on the table, usually the results will be very good because swelling hasn't started. So when the swelling, so this patient immediately after surgery, before we put the plaster, we'll give the mirror to him and make him watch the thing, and he's extremely happy and still happy about the results. And this is one of the, sometimes like patients push us to do something. After doing that, we feel we also learn, we also get some courage to go further and do the same kind of procedures in the further patients who ask for the local anesthesia. So yes, this patient has given me a confidence to perform the rhinoplasties and the local anesthesia. Though we do the LR base alone and the local, usually we don't do the tip work under local anesthesia. That's my practice. But a lot of people will do it, but I also have got some confidence.
So the next is about a body dysmorphic disorder patient. This is about a young guy who unmarried who came to us from a very remote area in Tamil Nadu, and he had a swelling in the malar region. So on bilateral side, he said he had applied some cream or something at home and he developed a lesion, and he had a mild swelling over there. So I think you saw him, and then the advice was to add a little bit of Kinocort, which is a local steroid which we give in certain areas where there is a resistant swelling. Now, this patient gave us a tough time after that, and during that course of time, you recognized him to be a body dysmorphic disorder. What would you say? How do you handle such kind of patients? And I'm sure he was just happy even talking to you every time he comes.
See, the body dysmorphic disorder clients are a peculiar, different kind of people. We used to see a lot of body dysmorphic disorder clients in our practice. As you said, she came for some swelling in the smaller region. Actually, nothing is much visible. Nothing is very distorting or like cosmetically disfiguring. And as soon as he's very, very socially lower middle class, we can say even lower class, the person not earning anything. And so when he came for a consultation itself, I know that he has a body dysmorphic disorder. First consultation itself, I know. We are practicing for the last 12 years. No, by this time, definitely we can pick up the body dysmorphic disorder easily. Once I picked up, he asked for some surgical procedure for this. I clearly tell that I want to avoid, because if you touch him, he'll be behind you and he never gets satisfied, and it will be a nightmare for you. And I know about it. So I just want to postpone, and I just don't want to encourage. And same time, I don't want him to go through some invasive procedures so that he also in trouble, we also in trouble. So I told, okay, just put an injection and you'll be fine, kind of. Actually, after putting the injection, that has a little bit bulge what he has come down also. And after that, he continuously started sending a WhatsApp messages in midnight and daytime, whenever. You can say that he'll be thinking about the problem more than 16 hours in a day. Okay, only few hours he's sleeping. Okay, but there is no problem at all. So he came back for a consultation, and we made him understand, you have this kind of issues, please do understand, meet a psychiatrist. And I am very well aware that if you explain them for 1 hour also, they'll ask, okay, what is next? What can be done for the procedure? But nowadays, even body dysmorphic disorder patients are also very much clear that they can't cheat me, or not cheating. They can't make me fall for their plans. So usually they'll give up and say, I'll go to a psychiatrist and come back, but they never come back. The problem is that one. I told him, I'll pay you 1,500 rupees for doctor psychiatrist consultation. You give the money and go and meet him and come. Initially, he said, no, I don't have money to go and meet the psychiatrist. Then I said, no, I'll pay the money, you go and meet the psychiatrist and come back. And he hasn't collected the money and he has not went to the psychiatrist. The first sad part is, you're all 20 plus, 25, 26 years old guy and falling prey for this kind of a psychiatric issues and spoiling the whole career just because of this issue, psychiatric issue. It's really sad. He's not useful to the family, the country, or wherever. So I try my best to convince, but 70% of the time I fail in convincing the body dysmorphic patients or patients. They'll go to the other plastic surgeons and they'll go for the multiple procedures. It's really a sad part.
So next we have two patients, both of them who gave us a tough time in the post-operative period and how we handle them. After that, we wrap up our this time session of plastic surgeon diary. The first patient is a male patient who came to Dr. Karthik for bilateral gynecomastia. Somehow, of course, the complaint was very genuine, and he convinced Dr. Karthik that he is very poor and unable to pay the huge, the fees that are due for the surgery. So we even operated on him at a discounted price. And he gave us a tough time in the post-surgery, not only the doctors, but in fact the nurses as well, where they had to multiple times repeat the instructions. All the post-operative instructions were repeated in the morning, afternoon, and evening. As he takes medicines, every time the sisters had to tell him how to take the medicine. So this case started getting a little weird for us. However, we handled the patient very well. But there was one occasion when he came to us maybe on the 5th day after surgery where he had a collection in the chest. So that was basically a seroma collection and we decided to put a drain. After that, Dr. Karthik, please go ahead and tell us what happened after that.
We still feel that gynecomastia is not a cosmetic surgery patient, and we still feel that every patient of gynecomastia has to be corrected. The cost should not be the problem, kind of. So really deserving candidates we want to do. See, the hospital where I operate, it's not mine. So they are going to pay only the hospital charges and the anesthetic charges. So it comes around approximately around 45 to 50,000, including you have to pay the service tax also. GST is around 18%. So minimum 50 to 55,000 it will be if you exclude our fee structure. So sometime when deserving candidate comes, we'll say that okay, you pay 50,000 and you get it done, and we want to help. He said he's some driver and I can't afford to pay, and he's not literate also. So see, sometimes I feel literacy plays a major role in cosmetic surgeries. In fact, because unless they understand the procedure well and go through the under the complete consequences of the procedure, better not to operate. But this guy we operated because we understood okay. But from the beginning, he's very demanding. I always tell it's my experience also. Whenever we give a discount to the patient or giving a lot of reduction in the price, they only give you a lot of troubles. People who pay the money fully and get the surgery done, it's a very cakewalk. Usually, even the little complication comes to us sometimes is usually the patient who may reduce the price or give a concession. And for some reason, it's happened. But this guy is demanding from the beginning. So we understand sometimes, the illiterate people, sometimes they'll behave differently. That doesn't mean that they are really harm to us. And after sometimes, once he came, he aspirated seroma. That's fine. Afterwards, he's fine. Then he went back. When I'm coming back, actually, I went to my hometown. Returning from my hometown. Dr. Anita called me saying that there is a blood collection in that one side of the chest. See, a lot of times these drivers are into a lot of drugs also. Though they say no, but a lot of times they're into drugs, smoking, and a lot of other stuff. So I was a little confused what to do. Okay, shift the patient to the theater, I'll come. Only this blood collection, we just aspirated and put the plasters and we came out under local anesthesia. And I told the sisters, don't send him back home. Make him stay in the hospital for 2 days. That and all we'll pay to the hospital. So don't collect anything from the patient. After 2 days, everything is fine and we want to send him. He said, no, I want to stay some more time. So we said, okay, you pay the money to the hospital and stay back. Then he said, no, I'm going. So sometimes we want to help the patient, they don't get the help. Now after 10 days, 10 days his visit is fine. 12th day again he came with a little collection of the blood. When he goes back home, sometimes happens something happening there. He is getting the blood collection. So now what he's saying is, sir, I don't know how I'm going to manage my whole life. Everything is settled now. Everything is fine. He's now saying how I'm going to manage the whole life because I have to drive the vehicle. My life is gone. We are trying to explain nothing going to happen. Everybody will have small issues. It all settles well. So don't worry, kind of. Like sometimes the literacy plays a major role in making the patient understand what they're going through. So see, that doesn't matter. It happens once in a while. So we don't mind helping the poor patients again and again. So we don't mind. So sometimes the poor patients will the people who pay less money has gives you a lot of trouble than people who pay the proper money.
Sir, and also I think it's very important to recognize this drug addiction people, and like you said, like you did, it's very important to keep them in the hospital for a longer day. Now, usually gynecomastia we treat it as a daycare procedure, but in this case, I feel all the things settle down only when we kept the patient in the hospital for some time. So I mean that was also something which was timely recognition on your part. You felt that no, let him not go home this time, let him stay back in the hospital. So that's also very important. Sometimes patients don't come forth and tell us their addiction, but it's important to recognize that and accordingly treat every patient differently.
Correct.
Next is another case, and this is the last case for today. Another patient who gave us a tough time post surgery. Now, this is a well-educated lady. She's an NRI citizen who comes to us for a tummy tuck procedure. The surgeon, she was well-read. She knew all the complications. She knew everything. She was also very bold to go through the procedure. Her recovery was quite nice for the first 3 days after surgery. Following which, he stopped coming for a follow-up. She had to even fly back to her country a few days in a week's time. So we were really hoping to see her quite often to help her. So during this time, she developed a seroma collection, and with much difficulty in her case, she had an umbilical hernia. So we had saved her umbilicus with a lot of difficulty. But because of the seroma collection and she was late to report to us, the umbilicus was almost getting compromised. So tell us your experience as to how you managed it. And now I think she's in touch with you after going back, and things have settled very well. So how did you manage this particular case?
See, as you said, no, it was very difficult surgery because usually when the umbilical hernia is there, most of the times, most of the surgeons, we compromise the navel and we close the navel side and we create the new umbilicus some other way. But in this case, with the great difficulty, we preserved the navel. Until 10 days, she was fine. And I think she came for the 8th day for the suture removal. Everything is fine. Everything is kind of okay. And after that, she disappeared, and we tried messaging her, not much reply. And suddenly one day she came with a huge collection. We asked her why you didn't come. I said, Doctor, I thought we'll be disturbing thing to you. She's the other extreme. This extreme is kind of wanting to disturb me every day without any reason, but she's the other extreme. And there's a lot of collection. She hasn't contacted us at all. So we aspirated the things. During that time, the navel becomes actually almost died. So we need to remove the navel skin, and then I'm just thinking how to handle it. It's a little difficult, she has flyback also. So little difficult to handle case. And what we did is we asked her to use Regenery ointment for some time, so that that granulation tissue becomes a little epithelialized, and the stock becomes a little epithelialized, so that wound heals faster, and there won't be any issues. So we gave that antibiotic, and because when she goes back and won't get infected, how to handle it, because we need to proactively manage everything. Okay, if this is the case, what are the medicine she has to take? Okay, ask them to get the medicines and keep it ready with her. Okay, this is the case, what has to be done? Okay, all those things has to be ready with her, because after she goes back to the other country, meeting the other doctors are a little difficult. So we always proactively handle this situation. So I asked her to keep all those things ready. So the secretions and all came down in a few days, not few days, maybe a week time. Then started slowly healing. That time navel stock, because there is no skin support, it tends to collapse. So to prevent that, I asked her to use the Vaseline gauze to pack the wound every day till it completely heals. So now it completely healed without any issue, with an almost normal navel, and he's a happy client. So sometimes it happens. We have to manage proactively. So the disturbance is not easy. Like, you have to tell us what is happening to you post surgery. Then only we can help you. Sometimes people are overreacting, and they'll be sending a lot of messages continuously. It doesn't matter. That's also actually acceptable. Then thinking that is a disturbance to the doctor, we should not tell kind of. Okay, we want to get a good results. We don't want to compromise the results because we worked 4 hours to struggle to get a good result. But when your result gets spoiled, we'll be really upset. So disturb us. We are here to get disturbed. Okay.
So that brings us to the end of this Plastic Surgeon's Diary, the 10th episode. So thank you everyone for joining and for listening to us patiently. Thank you, sir.
Thank you all. Thank you, Joyce.